My name is Nirav Shah. I'm an associate professor at the Medical College of Wisconsin. I'm also director of the bone marrow transplant and cell therapy program here with a focus in lymphomatous malignancies. So this was a phase 1/2 multi-cohort study. So we had previously investigated this construct LB2019 in a phase 1 study. This is a follow-up trial to really optimize the CAR T cell product and understand better how it works in disease-specific cohorts. We had a phase 1 safety run-in, looking at a different manufacturing platform where we actually shortened the manufacturing to an 8 to 12-day process. And once we showed safety, we had opened a dedicated arm in mantle cell lymphoma, and this was a phase 2 arm, mainly because mantle cell is a disease that's characterized by bright expression of CD20. And as mentioned, this CAR T cell product is unique in that it targets both CD19, a traditional target, and CD20. So we studied this in patients with relapsed refractory mantle cell lymphoma. So the median lines of treatment for this patient population was actually 4, demonstrating that they were quite refractory patients that had seen lots of other therapies. Every single patient were BTK inhibitor exposed, and about half the patients actually had a p53 aberration. This just tells you that the demographic of this mantle cell population was quite sick and had seen other lines of therapy. We administered this CAR T cell product as a single infusion after an 8 to 12-day manufacturing process as a fresh infusion. And we were incredibly surprised and pleased to report an overall response rate of 100%. So all 17 patients in the phase 1 and 2 clinical trial here responded to the drug. And a lot of the patients continued to have a durable remission even after this CAR T cell product. And in total, only 2 of the patients have relapsed at the time of the publication of this study. And then additionally, I can also share that the safety profile of this study was quite favorable. There were no patients with high-grade cytokine release syndrome, so grade 3 to 4, and there were low rates of grade 3 or higher neurotoxicity events. In fact, there were just 2 patients in the cohort that had only grade 3 neurotoxicity, both of which was reversible with treatment. And so we're very excited by these results. They, of course, represent a single center study. And so the next step is, taking this product, and we've actually are working with a sponsor, and a phase 2 clinical trial is actively enrolling patients in relapsed refractory mantle cell lymphoma. This is a multi-center study enrolling at sites across the United States, looking at a patient population very similar to the one described in this study with the similar CAR T cell product, anti-CD20, anti-CD19. I think the results are exciting. Mantle cell is a difficult disease to treat. Here, we saw a high response rate with durability. Of course, it's limited follow-up, and it's limited by the single center nature of this trial. That being said, as I've described, they were a sick group of patients that have seen many other lines of therapy. The larger study is ongoing, and so if you're interested, you can find the Daily 2 clinical trial on clinicaltrials.gov, and they're actively accruing patients with relapsed refractory mantle cell lymphoma. And that trial was really designed based on the initial results that we saw here on this clinical trial that we hope to replicate now in a larger multi-center setting.